Section 22 of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Recording by Leanne Howlett. Anatomy of the Human Body, Part 3 by Henry Gray. The ulnar artery. 4b. 4. The ulnar artery. A. ulnaris. The ulnar artery, the larger of the two terminal branches of the brachial, begins a little below the bend of the elbow, and, passing obliquely downward, reaches the ulnar side of the forearm at a point about midway between the elbow and the wrist. It then runs along the ulnar border to the wrist, crosses the transverse carpal ligament on the radial side of the pisiform bone, and immediately beyond this bone divides into two branches, which enter into the formation of the superficial and deep volar arches. Relations. A. In the forearm. In its upper half it is deeply seated, being covered by the pronator teres, flexor carpi radialis, palmaris longus, and flexor digitorum sublimis. It lies upon the brachialis and flexor digitorum profundus. The median nerve is in relation with the medial side of the artery for about 2.5 centimeters, and then crosses the vessel, being separated from it by the ulnar head of the pronator teres. In the lower half of the forearm it lies upon the flexor digitorum profundus, being covered by the integument and the superficial and deep fasciae, and placed between the flexor carpi ulnaris and flexor digitorum sublimis. It is accompanied by two venae comitantes, and is overlapped in its middle third by the flexor carpi ulnaris. The ulnar nerve lies on the medial side of the lower two-thirds of the artery, and the palmar cutaneous branch of the nerve descends on the lower part of the vessel to the palm of the hand. B. At the wrist the ulnar artery is covered by the integument and the volar carpal ligament, and lies upon the transverse carpal ligament. On its medial side is the pisiform bone, and somewhat behind the artery, the ulnar nerve. Peculiarities. The ulnar artery varies in its origin in the proportion of about 1 in 13 cases. It may arise about 5 to 7 centimeters below the elbow, but more frequently higher, the brachial being more often the source of origin than the axillary. Variations in the position of this vessel are more common than in the radial. When its origin is normal, the course of the vessel is rarely changed. When it arises high up, it is almost invariably superficial to the flexor muscles in the forearm, lying commonly beneath the fascia, more rarely between the fascia and integument. In a few cases its position was subcutaneous in the upper part of the forearm, and subaponeurotic in the lower part. Branches. The branches of the ulnar artery may be arranged in the following groups. In the forearm, anterior recurrent, posterior recurrent, common interosseous. At the wrist, volar carpal, dorsal carpal, deep volar. In the hand, muscular, superficial volar arch. The anterior ulnar recurrent artery, A. recurrens ulnaris anterior, arises immediately below the elbow joint, runs upward between the brachialis and pronator teres, supplies twigs to those muscles, and in front of the medial epicondyle, anastomoses with the superior and inferior ulnar collateral arteries. The posterior ulnar recurrent artery, A. recurrens ulnaris posterior, is much larger, and arises somewhat lower than the preceding. It passes backward and medialward on the flexor digitorum profundus, behind the flexor digitorum sublimis, and ascends behind the medial epicondyle of the humerus. In the interval between this process and the olecranon it lies beneath the flexor carpi ulnaris, and ascending between the heads of that muscle, in relation with the ulnar nerve, it supplies the neighboring muscles and the elbow joint, and anastomoses with the superior and inferior ulnar collateral and the interosseous recurrent arteries. The common interosseous artery, A. interossea communis, about 1 cm in length, arises immediately below the tuberosity of the radius, and, passing backward to the upper border of the interosseous membrane, divides into two branches, the volar and dorsal interosseous arteries. The volar interosseous artery, A. interossea volaris, anterior interosseous artery, passes down the forearm on the volar surface of the interosseous membrane. It is accompanied by the volar interosseous branch of the median nerve, and overlapped by the contiguous margins of the flexor digitorum profundus and flexor pollicis longus, giving off in this situation muscular branches, and the nutrient arteries of the radius and ulna. At the upper border of the pronator quadratus, it pierces the interosseous membrane and reaches the back of the forearm, where it anastomoses with the dorsal interosseous artery. It then descends, in company with the terminal portion of the dorsal interosseous nerve, to the back of the wrist to join the dorsal carpal network. The volar interosseous artery gives off a slender branch, the arteria mediana, which accompanies the median nerve, and gives offsets to its substance. This artery is sometimes much enlarged, and runs with the nerve into the palm of the hand. Before it pierces the interosseous membrane, the volar interosseous sends a branch downward behind the pronator quadratus to join the volar carpal network. The dorsal interosseous artery, A. interossea dorsalis, posterior interosseous artery, passes backward between the oblique cord and the upper border of the interosseous membrane. It appears between the contiguous borders of the supinator and the abductor pollicis longus, and runs down the back of the forearm between the superficial and deep layers of muscles, to both of which it distributes branches. Where it lies upon the abductor pollicis longus and the extensor pollicis brevis, it is accompanied by the dorsal interosseous nerve. At the lower part of the forearm, an anastomoses with the termination of the volar interosseous artery and with the dorsal carpal network. It gives off near its origin the interosseous recurrent artery, which ascends to the interval between the lateral epicondyle and olecranon, on or through the fibers of the supinator, but beneath the anconeus, and anastomoses with the radial collateral branch of the profunda brachii, the posterior ulnar recurrent, and the inferior ulnar collateral. The muscular branches, rami muscularis, are distributed to the muscles along the ulnar side of the forearm. The volar carpal branch, ramus carpius volaris, anterior ulnar carpal artery, is a small vessel which crosses the front of the carpus beneath the tendons of the flexor digitorum profundus, and anastomoses with the corresponding branch of the radial artery. The dorsal carpal branch, ramus carpius dorsalis, posterior ulnar carpal artery, arises immediately above the pisiform bone, and winds backward beneath the tendon of the flexor carpi ulnaris. It passes across the dorsal surface of the carpus beneath the extensor tendons to anastomose with a corresponding branch of the radial artery. Immediately after its origin, it gives off a small branch, which runs along the ulnar side of the fifth metacarpal bone, and supplies the ulnar side of the dorsal surface of the little finger. The deep volar branch, ramus volaris profundus, profunda branch, passes between the abductor digiti quinti and flexor digiti quinti brevis, and through the origin of the opponens digiti quinti, it anastomoses with the radial artery and completes the deep volar arch. The superficial volar arch, arcus volaris superficialis, superficial palmar arch, is formed by the ulnar artery, and is usually completed by a branch from the A. volaris indicis radialis, but sometimes by the superficial volar, or by a branch from the A. princeps pollicis of the radial artery. The arch passes across the palm, describing a curve with its convexity downward. Relations. The superficial volar arch is covered by the skin, the palmaris brevis and the palmar aponeurosis. It lies upon the transverse carpal ligament, the flexor digiti quinti brevis and opponens digiti quinti, the tendons of the flexor digitorum sublimis, the lumbricals, and the divisions of the median and ulnar nerves. Three common volar digital arteries, AA digitalis volaris communis, palmar digital arteries, arise from the convexity of the arch and proceed downward on the second, third, and fourth lumbricals. Each receives the corresponding volar metacarpal artery and then divides into a pair of proper volar digital arteries, AA digitalis volaris proprii, collateral digital arteries, which run along the contiguous sides of the index, middle, ring, and little fingers behind the corresponding digital nerves. They anastomose freely in the subcutaneous tissue of the fingertips and by smaller branches near the interphalangeal joints. Each gives off a couple of dorsal branches which anastomose with the dorsal digital arteries and supply the soft parts on the back of the second and third phalanges, including the matrix of the fingernail. The proper volar digital artery for medial side of the little finger springs from the ulnar artery under cover of the palmaris brevis. End of section 22. Recording by Leanne Howlett.
Section 23 of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by Mary Ann Coleman Hipkins. Anatomy of the Human Body, Part 3 by Henry Gray. Arteries of the trunk, descending aorta, thoracic aorta. The descending aorta is divided into two portions, the thoracic and abdominal, in correspondence with the two great cavities of the trunk in which it is situated. 1. The thoracic aorta. Aorta thoracalis. The thoracic aorta is contained in the posterior mediastinal cavity. It begins at the lower border of the fourth thoracic vertebra, where it is continuous with the aortic arch, and ends in front of the lower border of the 12th, at the aortic hiatus in the diaphragm. At its commencement, it is situated on the left of the vertebral column. It approaches the median line as it descends, and, at its termination, lies directly in front of the column. The vessel describes a curve which is concave forward, and as the branches given off from it are small, its diminution in size is inconsiderable. Relations. It is in relation anteriorly from above downward with the root of the left lung, the pericardium, the esophagus, and the diaphragm posteriorly with the vertebral column and the hemiazygos veins on the right side, with the azygos vein and thoracic duct on the left side, with the left pleura and lung. The esophagus, with its accompanying plexus of nerves, lies on the right side of the aorta, above, but at the lower part of the thorax. It is placed in front of the aorta and, close to the diaphragm, is situated on its left side. Peculiarities. The aorta is occasionally found to be obliterated at the junction of the arch with the thoracic aorta just below the ductus arteriosus. Whether this is the result of disease or of congenital malformation is immaterial to our present purpose. It affords an interesting opportunity of observing the resources of the collateral circulation. The course of the anastomosing vehicles by which the blood is brought from the upper to the lower part of the artery will be found well described in an account of two cases in the Pathological Transactions, volumes 8 and 10. In the former, Sidney Jones thus sums up the detailed description of the anastomosing vessels. The principal communications by which the circulation was carried on were 1. The internal mammary anastomosing with the intercostal arteries, with the inferior phrenic of the abdominal aorta by means of the musculophrenic and periocardiacophrenic, and largely with the inferior epigastric. 2. The costocervical trunk anastomosing anteriorly by means of a large branch, with the first aortic intercostal, and posteriorly with the posterior branch of the same artery. 3. The inferior thyroid by means of a branch about the size of an ordinary radial, forming a communication with the first aortic intercostal. 4. The transverse cervical by means of a very large communications with the posterior branches of the intercostals. 5. The branches of the subclavian and axillary going to the side of the chest were large, and anastomosed freely with the lateral branches of the intercostals. In the second case, Wood describes the anastomoses in a somewhat similar manner, adding the remark that the blood which was brought into the aorta through the anastomosis of the intercostal arteries appeared to be expanded principally in supplying the abdomen and pelvis, while the supply to the lower extremities had passed through the internal mammary and epigastrics. In a few cases, an apparently double descending thoracic aorta has been found, the two vessels lying side by side and eventually fusing to form a single tube in the lower part of the thorax, or in the abdomen. One of them is the aorta. The other represents a dissecting aortic aneurysm, which has become canalized, opening above and below into the true aorta, and at first sight presenting the appearances of a proper blood vessel. Branches of the thoracic aorta: visceral, pericardial, bronchial, esophageal, mediastinal; parietal, intercostal, subcostal, superior phrenic. The pericardial branches, rami pericardiaceae, consist of a few small vessels which are distributed to the posterior surface of the pericardium. The bronchial arteries, AA bronchialis, vary in number, size, and origin. There is, as a rule, only one right bronchial artery, which arises from the first aortic intercostal, or from the upper left bronchial artery. The left bronchial arteries are usually two in number, and arise from the thoracic aorta. The upper left bronchial arises opposite the fifth thoracic vertebra, the lower just below the level of the left bronchus. Each vessel runs on the back part of its bronchus, dividing and subdividing along the bronchial tubes, supplying them the areolar tissue of the lungs, the bronchial lymph glands, and the esophagus. The esophageal arteries, AA esophageae, 4 or 5 in number, arise from the front of the aorta and pass obliquely downward to the esophagus, forming a chain of anastomoses along that tube, anastomosing with the esophageal branches of the inferior thyroid arteries above, and with ascending branches from the left inferior phrenic and left gastric arteries below. The mediastinal branches, rami mediastinalis, are numerous small vessels which supply the lymph glands and loose areolar tissue in the posterior mediastinum. Intercostal arteries, AA intercostalis. There are usually 9 pairs of aortic intercostal arteries. They arise from the back of the aorta and are redistributed to the lower 9 intercostal spaces, the first 2 spaces being supplied by the highest intercostal artery, a branch of the costocervical trunk of the subclavian. The right aortic intercostals are longer than the left, on account of the position of the aorta, on the left side of the vertebral column. They pass across the bodies of the vertebrae behind the esophagus, thoracic duct, and vena arsagos, and are covered by the right lung and pleura. The left aortic intercostals run backward on the sides of the vertebrae and are covered by the left lung and pleura. The upper two vessels are crossed by the highest left intercostal vein, the lower vessels by the hemizygos veins. The further course of the intercostal arteries is practically the same on both sides. Opposite the heads of the ribs, the sympathetic trunk passes downward in front of them, and the splenic nerves also descend in front by the lower arteries. Each artery then divides into an anterior and a posterior ramus. The anterior ramus crosses the corresponding intercostal space obliquely toward the angle of the upper rib, and thence is continued forward in the costal groove. It is placed at first between the pleura and the posterior intercostal membrane. Then it pierces this membrane and lies between it and the intercostalis externus as far as the angle of the rib. From this onward it runs between the intercostalis externus and internus, and anastomoses in front with the intercostal branch of the internal mammary or musculophrenic. Each artery is accompanied by a vein and a nerve, the former being above and the latter below the artery, except in the upper spaces where the nerve is at first above the artery. The first aortic intercostal artery, anastomoses, with the intercostal branch of the costocervical trunk, and may form the chief supply of the second intercostal space. The lower two intercostal arteries are continued anteriorly from the intercostal spaces into the abdominal wall, and anastomose with the subcostal, superior epigastric, and lumbar arteries. Branches. The anterior rami give off the following branches: collateral intercostal, muscular, lateral cutaneous, mammary. The intercostal branch comes off from the intercostal artery near the angle of the rib and descends to the upper border of the rib below, along which it courses to anastomose with the intercostal branch of the internal mammary. Muscular branches are given to the intercostalis and pectoralis and to the serratus anterior. They anastomize with the highest and lateral thoracic branches of the axillary artery. The lateral cutaneous branches accompany the lateral cutaneous branches of the thoracic nerves. Mammary branches are given off by the vessels in the third, fourth, and fifth spaces. They supply the mamma and increase considerably in size during the period of lactation. The posterior ramus runs backward through a space which is bounded above and below by the necks of the ribs, medially by the body of a vertebra, and laterally by an anterior costotransverse ligament. It gives off a spinal branch which enters the vertebral canal through the intervertebral foramen and is distributed to the medulla spinalis and its membranes and the vertebrae. It then courses over the transverse process with the posterior division of the thoracic nerve, supplies branches to the muscles of the back, and cutaneous branches, which accompany the corresponding cutaneous branches of the posterior division of the nerve. The subcostal arteries, so named because they lie below the last ribs, constitute the lowest pair of branches derived from the thoracic aorta and are in series with the intercostal arteries. Each passes along the lower border of the 12th rib behind the kidney and in front of the quadratus lumborum muscle, and is accompanied by the 12th thoracic nerve. It then pierces the posterior aponeurosis of the transversus abdominis, and passing forward between this muscle and the obliquus internus, anastomoses with the superior epigastric, lower intercostal, and lumbar arteries. Each subcostal artery gives off a posterior branch which has a similar distribution to the posterior ramus of an intercostal artery. The superior phrenic branches are small and arise from the lower part of the thoracic aorta. They are distributed to the posterior part of the upper surface of the diaphragm and anastomose with the musculophrenic and the periocardiacophrenic arteries. A small aberrant artery is sometimes found arising from the right side of the thoracic aorta, near the origin of the right bronchiole. It passes upward into the right behind the trachea and the esophagus, and may anastomose with the highest right intercostal artery. It represents the remains of the right dorsal aorta, and in a small proportion of cases is enlarged to form the first part of the right subclavian artery. End of section 23. Recording by Laurie Anne Hipkins. 24 of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by Laurie Anne Hipkins. Anatomy of the Human Body, Part 3, by Henry Gray. The Abdominal Aorta, Part 1. 5a-2. The Abdominal Aorta, Aorta abdominalis. The abdominal aorta begins at the aortic hiatus of the diaphragm, in front of the lower border of the body of the last thoracic vertebra, and, descending in front of the vertebral column, ends on the body of the fourth lumbar vertebra, commonly a little to the left of the middle line. Footnote 103. Lord Lister, having accurately examined 30 bodies in order to ascertain the exact point of termination of this vessel, found it either absolutely or almost absolutely mesial in 15, while in 13 it deviated more or less to the left, and in 2 was slightly to the right. System of Surgery, edited by T. Holmes, 2nd edition, verse 652. End of footnote. By dividing into the 2 common iliac arteries, it diminishes rapidly in size in consequence of the many large branches which it gives off as it lies upon the bodies of the vertebrae. The curve which it describes is convex forward, the summit of the convexity corresponding to the third lumbar vertebra. Relations. The abdominal aorta is covered anteriorly by the lesser omentum and stomach, behind which are the branches of the celiac artery and the celiac plexus. Below these by the lional vein, the pancreas, the left renal vein, the inferior part of the duodenum, the mesentery and aortic plexus. Posteriorly, it is separated from the lumbar vertebrae and intervertebral fibrocartilages by the anterior longitudinal ligament and left lumbar veins. On the right side, it is in relation above with the azygos vein, cisterna chyli, thoracic duct, and the right crus of the diaphragm, the last separating it from the upper part of the inferior vena cava and from the right celiac ganglion. The inferior vena cava is in contact with the aorta below. On the left side are the left crus of the diaphragm, the left celiac ganglion, the ascending part of the duodenum, and some coils of the small intestine. Collateral circulation. The collateral circulation would be carried on by the anastomoses between the internal mammary and the inferior epigastric, by the free communication between the superior and inferior mesenterics, if the ligature were placed between these vessels, or by the anastomosis between the inferior mesenteric and the internal pudendal, when, as is more common, the point of ligature is below the origin of the inferior mesenteric, and possibly by the anastomoses of the lumbar arteries with the branches of the hypogastric. Branches. The branches of the abdominal aorta may be divided into 3 sets: visceral, parietal, and terminal. Visceral branches: celiac, superior mesenteric, inferior mesenteric, middle suprarenals, renals, internal spermatics, ovarian in the female. Parietal branches: inferior phrenics, lumbars, middle sacral. Terminal branches: common iliacs. Of the visceral branches, the celiac artery and the superior and inferior mesenteric arteries are unpaired, while the suprarenals, renals, internal spermatics, and ovarian are paired. Of the parietal branches, the inferior phrenics and lumbars are paired, the middle sacral is unpaired, the terminal branches are paired. The celiac artery, A. celiaca, celiac axis, is a short, thick trunk, about 1.25 centimeters in length, which arises from the front of the aorta, just below the aortic hiatus of the diaphragm, and passing nearly horizontally forward, divides into 3 large branches: the left gastric, the hepatic, and the splenic. It occasionally gives off one of the inferior phrenic arteries. Relations: the celiac artery is covered by the lesser omentum. On the right side, it is in relation with the right celiac ganglion and the caudate process of the liver. On the left side, with the left celiac ganglion and the cardiac end of the stomach. Below, it is in relation to the upper border of the pancreas and the lienal vein. 1. The left gastric artery, A. gastrica sinistra, gastric or coronary artery. The smallest of the 3 branches of the celiac artery passes upward and to the left, posterior to the omental bursa, to the cardiac orifice of the stomach. Here it distributes branches to the esophagus, which anastomose with the aortic esophageal arteries. Others supply the cardiac part of the stomach, anastomosing with branches of the lienal artery. It then runs from left to right along the lesser curvature of the stomach to the pylorus, between the layers of the lesser omentum. It gives branches to both surfaces of the stomach and anastomoses with the right gastric artery. 2. The hepatic artery, A. hepatica. In the adult is intermediate in size between the left gastric and lienal. In the fetus, it is the largest of the 3 branches of the celiac artery. It is first directed forward and to the right, to the upper margin of the superior part of the duodenum, forming the lower boundary of the epiploic foramen of Winslow. It then crosses the portal vein anteriorly and ascends between the layers of the lesser omentum and in front of the epiploic foramen to the portal hepatus, where it divides into 2 branches, right and left, which supply the corresponding lobes of the liver, accompanying the ramifications of the portal vein and hepatic ducts. The hepatic artery, in its course along the right border of the lesser omentum, is in relation with the common bile duct and portal vein, the duct lying to the right of the artery and the vein behind. Its branches are right gastric epiploic, gastroduodenal, superior pancreatico-duodenal, cystic. The right gastric artery, A. gastrica dextra, pyloric artery, arises from the hepatic above the pylorus, descends to the pyloric end of the stomach, and passes from right to left along its lesser curvature, supplying it with branches and anastomosing with the left gastric artery. The gastroduodenal artery, A. gastroduodenalis, is a short but large branch which descends near the pylorus, between the superior part of the duodenum and the neck of the pancreas, and divides at the lower border of the duodenum into 2 branches, the right gastric epiploic and the superior pancreatico-duodenal. Previous to its division, it gives off 2 or 3 small branches to the pyloric end of the stomach and to the pancreas. The right gastric epiploic artery, A. gastroepiploica dextra, runs from right to left along the greater curvature of the stomach between the layers of the greater omentum, anastomosing with the left gastroepiploic branch of the lienal artery. Except at the pylorus, where it is in contact with the stomach, it lies about a finger's breadth from the greater curvature. This vessel gives off numerous branches, some of which ascend to supply both surfaces of the stomach, while others descend to supply the greater omentum and anastomose with branches of the middle colic. The superior pancreatico-duodenal artery, A. pancreatico-duodenalis superior, descends between the contiguous margins of the duodenum and pancreas. It supplies both these organs and anastomoses with the inferior pancreatico-duodenal branch of the superior mesenteric artery and with the pancreatic branches of the lienal artery. The cystic artery, A. cystica, usually a branch of the right hepatic, passes downward and forward along the neck of the gallbladder and divides into 2 branches, one of which ramifies on the free surface, the other on the attached surface of the gallbladder. The lienal or splenic artery, A. lienalis, the largest branch of the iliac artery, is remarkable for the tortuosity of its course. It passes horizontally to the left side, behind the stomach and the omental bursa of the peritoneum, and along the upper border of the pancreas, accompanied by the lienal vein, which lies below it. It crosses in front of the upper part of the left kidney, and on arriving near the spleen divides into branches, some of which enter the hilus of that organ between the 2 layers of the phrenico-lienal ligament, to be distributed to the tissues of the spleen. Some are given to the pancreas, while others pass to the greater curvature of the stomach between the layers of the gastrolienal ligament. Its branches are pancreatic, short gastric, left gastroepiploic. The pancreatic branches, rami pancreatici, are numerous small vessels derived from the lienal as it runs behind the upper border of the pancreas, supplying its body and tail. One of these, larger than the rest, is sometimes given off near the tail of the pancreas. It runs from left to the right, near the posterior surface of the gland, following the course of the pancreatic duct, and is called the arteria pancreatica magna. These vessels anastomose with the pancreatic branches of the pancreatico-duodenal and superior mesenteric arteries. The short gastric arteries, AA gastricae brevis, vasa brevia, consist of from 5 to 7 small branches, which arise from the end of the lienal artery and from its terminal divisions. They pass from left to right between the layers of the gastrolienal ligament and are distributed to the greater curvature of the stomach, anastomosing with the branches of the left gastric and left gastroepiploic arteries. The left gastroepiploic artery, A. gastroepiploica sinistra, the largest branch of the lienal, runs from left to right, about a finger's breadth or more from the greater curvature of the stomach, between the layers of the greater omentum, and anastomoses with the right gastroepiploic. In its course it distributes several ascending branches to both surfaces of the stomach. Others descend to supply the greater omentum and anastomose with branches of the middle colic. The superior mesenteric artery, A. mesenterica superior, is a large vessel which supplies the whole length of the small intestine except the superior part of the duodenum. It also supplies the caecum and the ascending part of the colon, and about 1/2 of the transverse part of the colon. It arises from the front of the aorta, about 1.25 centimeters below the iliac artery, and is crossed at its origin by the lienal vein and the neck of the pancreas. It passes downward and forward, anterior to the processus inclinatus of the head of the pancreas and inferior part of the duodenum, and descends between the layers of the mesentery to the right iliac fossa, where, considerably diminished in size, it anastomoses with one of its own branches, viz. the iliocolic. In its course it crosses in front of the inferior vena cava, the right ureter and psoas major, and forms an arch, the convexity of which is directed forward and downward to the left side, the concavity backward and upward to the right. It is accompanied by the superior mesenteric vein, which lies to its right side, and it is surrounded by the superior mesenteric plexus of nerves. Branches. Its branches are inferior pancreatico-duodenal, intestinal, iliocolic, right colic, middle colic. The inferior pancreatico-duodenal artery, A. pancreatico-duodenalis inferior, is given off from the superior mesenteric or from its first intestinal branch, opposite the upper border of the inferior part of the duodenum. It courses to the right between the head of the pancreas and duodenum, and then ascends to anastomose with the superior pancreatico-duodenal artery. It distributes branches to the head of the pancreas and to the descending and inferior parts of the duodenum. The intestinal arteries, AA intestinalis, vasa intestini tenis, arise from the convex side of the superior mesenteric artery. They are usually from 12 to 15 in number, and are distributed to the jejunum and ilium. They run nearly parallel with one another between the layers of the mesentery, each vessel dividing into two branches, which unite with adjacent branches, forming a series of arches, the convexities of which are directed toward the intestine. From this first set of arches, branches arise, which unite with similar branches from above and below, and thus a second series of arches is formed. From the lower branches of the artery, a third, a fourth, or even a fifth series of arches may be formed, diminishing in size the nearer they approach the intestine. In the short upper part of the mesentery, only one set of arches exists, but as the depth of the mesentery increases, second, third, fourth, or even fifth groups are developed. From the terminal arches, numerous small, slight vessels arise, which encircle the intestine, upon which they are distributed, ramifying between its coats. From the intestinal arteries, small branches are given off to the lymph glands and other structures between the layers of the mesentery. The iliocolic artery, A. iliocolica, is the lowest branch, arising from the concavity of the superior mesenteric artery. It passes downward and to the right behind the peritoneum toward the right iliac fossa, where it divides into a superior and an inferior branch. The inferior anastomoses with the end of the superior mesenteric artery, the superior with the right colic artery. The inferior branch of the iliocolic runs toward the upper border of the iliocolic junction and supplies the following branches: A. Colic, which pass upward on the ascending colon. B. Anterior and posterior cecal, which are distributed to the front and back of the cecum. C. An appendicular artery, which descends behind the termination of the ilium and enters the mesenteriole of the veriform process. It runs near the free margin of this mesenteriole and ends in branches which supply the veriform process. And D. Ileal, which run upward and to the left on the lower part of the ilium and anastomose with the termination of the superior mesenteric. The right colic artery, A. colica dextra, arises from the middle of the concavity of the superior mesenteric artery, or from a stem common to it and the iliac. It passes to the right behind the peritoneum and in front of the right internal spermatic or ovarian vessels, the right ureter and the psoas major, toward the middle of the ascending colon. Sometimes the vessel lies at a higher level and crosses the descending part of the duodenum and the lower end of the right kidney. At the colon, it divides into a descending branch which anastomoses with the iliac and an ascending branch which anastomoses with the middle colic. These branches form arches, from the convexity of which the vessels are distributed to the ascending colon. The middle colic artery, A colica media, arises from the superior mesenteric just below the pancreas, and passing downward and forward between the layers of the transverse mesocolon, divides into two branches, right and left. The former anastomoses with the right colic, the latter with the left colic, a branch of the inferior mesenteric. The arches thus formed are placed about 2 fingers' breadth from the transverse colon, to which they distribute branches. End of section 24. Recording by Laurie Anne Hipkins. Of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by Laurie Anne Hipkins. Anatomy of the Human Body, Part 3, by Henry Gray. The Abdominal Aorta, Part 1. 5a2. The Abdominal Aorta, Aorta abdominalis. The inferior mesenteric artery, A mesenterica inferior, supplies the left half of the transverse part of the colon, the whole of the descending and iliac parts of the colon, the sigmoid colon, and the greater part of the rectum. It is smaller than the superior mesenteric and arises from the aorta about 3 or 4 centimeters above its division into the common iliacs and close to the lower border of the inferior part of the duodenum. It passes downward posterior to the peritoneum, lying at first anterior to and then on the left side of the aorta. It crosses the left common iliac artery and is continued into the lesser pelvis under the name of the superior hemorrhoidal artery, which descends between the 2 layers of the sigmoid mesocolon and ends on the upper part of the rectum. Branches. Its branches are left colic, sigmoid, superior hemorrhoidal. The left colic artery, A colica sinistra, runs from the left behind the peritoneum and in front of the psoas major, and after a short but variable course divides into an ascending and a descending branch. The stem of the artery or its branches cross the left ureter and left internal spermatic vessels. The ascending branch crosses in front of the left kidney and ends between the 2 layers of the transverse mesocolon by anastomosing with the middle colic artery. The descending branch anastomoses with the highest sigmoid artery. From the arches formed by these anastomoses, branches are distributed to the descending colon and the left part of the transverse colon. The sigmoid arteries, AA sigmoideae, 2 or 3 in number, run obliquely downward and to the left behind the peritoneum and in front of the psoas major, ureter, and internal spermatic vessels. Their branches supply the lower part of the descending colon, the iliac colon, and the sigmoid or pelvic colon, anastomosing above with the left colic and below with the superior hemorrhoidal artery. The superior hemorrhoidal artery, A hemorrhoidalis superior. The continuation of inferior mesenteric descends into the pelvis between the layers of the mesentery of the sigmoid colon, crossing in its course the left common iliac vessels. It divides opposite the 3rd sacral vertebra into 2 branches, which descend one on either side of the rectum, and about 10 or 12 centimeters from the anus break up into several small branches. These pierce the muscular coat of the bowel and run downward as straight vessels placed at regular intervals from each other in the wall of the gut, between its muscular and mucous coats, to the level of the sphincter ani internus. Here they form a series of loops around the lower end of the rectum, and communicate with the middle hemorrhoidal branches of the hypogastric, and with the inferior hemorrhoidal branches of the internal pudendal. The middle suprarenal arteries, AA suprarenalis media, middle capsular arteries, suprarenal arteries, are two small vessels which arise, one from either side of the aorta, opposite the superior mesenteric artery. They pass lateralward and slightly upward over the crura of the diaphragm to the suprarenal glands, where they anastomose with the suprarenal branches of the inferior phrenic and renal arteries. In the fetus, these arteries are of large size. The renal arteries, AA renalis, are two large trunks which arise from the side of the aorta, immediately below the superior mesenteric artery. Each is directed across the crus of the diaphragm so as to form nearly a right angle with the aorta. The right is longer than the left on account of the position of the aorta. It passes behind the inferior vena cava, the right renal vein, the head of the pancreas, and the descending part of the duodenum. The left is somewhat higher than the right. It lies behind the left renal vein, the body of the pancreas, and the lional vein, and is crossed by the inferior mesenteric vein. Before reaching the hilus of the kidney, each artery divides into 4 or 5 branches. The greater number of these lie between the renal vein and ureter, the vein being in front, the ureter behind, but one or more branches are usually situated behind the ureter. Each vessel gives off small inferior suprarenal branches to the suprarenal gland, the ureter, and the surrounding cellular tissue and muscle. 1 or 2 accessory renal arteries are frequently found, more especially on the left side. They usually arise from the aorta and may come off above or below the main artery, the former being the more common position. Instead of entering the kidney at the hilus, they usually pierce the upper or lower part of the gland. The internal spermatic arteries, AA spermaticae internae, spermatic arteries, are distributed to the testes. They are 2 slender vessels of considerable length, and arise from the front of the aorta a little below the renal arteries. Each passes obliquely downward and lateralward behind the peritoneum, resting on the psoas major. The right spermatic line in front of the inferior vena cava and behind the middle colic and iliocolic arteries and the terminal part of the ileum. The left behind the left colic and sigmoid arteries and the iliac colon. Each crosses obliquely over the ureter and the lower part of the external iliac artery to reach the abdominal inguinal ring, through which it passes, and accompanies the other constituents of the spermatic cord along the inguinal canal to the scrotum, where it becomes tortuous and divides into several branches. 2 or 3 of these accompany the ductus deferens and supply the epididymis, anastomosing with the artery of the ductus deferens. Others pierce the back of the tunica albuginea and supply the substance of the testes. The internal spermatic artery supplies 1 or 2 small branches to the ureter, and in the inguinal canal gives 1 or 2 twigs to the cremaster. The ovarian arteries, AA ovaricae, are the corresponding arteries in the female to the internal spermatic in the male. They supply the ovaries, are shorter than the internal spermatics, and do not pass out of the abdominal cavity. The origin and course of the first part of each artery are the same as those of the internal spermatic, but on arriving at the upper opening of the lesser pelvis, the ovarian artery passes inward between the 2 layers of the ovariopelvic ligament and of the broad ligament of the uterus, to be distributed to the ovary. Small branches are given to the ureter and the uterine tube, and one passes on to the side of the uterus and unites with the uterine artery. The other offsets are continued on the round ligament of the uterus through the inguinal canal to the integument of the labium majus and groin. At an early period of fetal life, when the testes or ovaries lie by the side of the vertebral column below the kidneys, the internal spermatic or ovarian arteries are short, but with the descent of these organs into the scrotum or lesser pelvis, the arteries are gradually lengthened. The inferior phrenic arteries, AA phrenicae inferiores, are two small vessels which supply the diaphragm but present much variety in their origin. They may arise separately from the front of the aorta, immediately above the iliac artery, or by a common trunk which may spring either from the aorta or from the iliac artery. Sometimes one is derived from the aorta and the other from one of the renal arteries. They rarely arise as separate vessels from the aorta. They diverge from one another across the carura of the diaphragm, and then run obliquely upward and lateralward upon its surface. The left phrenic passes behind the esophagus and runs forward on the left side of the esophageal hiatus. The right phrenic passes behind the inferior vena cava and along the right side of the foramen, which transmits that vein. Near the back part of the central tendon, each vessel divides into a medial and a lateral branch. The medial branch curves forward and anastomoses with its fellow of the opposite side, and with the musculophrenic and pericardiacophrenic arteries. The lateral branch passes toward the side of the thorax and anastomoses with the lower intercostal arteries and with the musculophrenic. The lateral branch of the right phrenic gives off a few vessels to the inferior vena cava, and the left one some branches to the esophagus. Each vessel gives off superior suprarenal branches to the suprarenal gland of its own side. The spleen and the liver also receive a few twigs from the left and the right vessels respectively. The lumbar arteries, AA lumbalis, are in series with the intercostals. They are usually 4 in number on either side, and arise from the back of the aorta, opposite the bodies of the upper 4 lumbar vertebrae. A fifth pair, small in size, is occasionally present when they arise from the middle sacral artery. They run lateralward and backward on the bodies of the lumbar vertebrae, behind the sympathetic trunk, to the intervals between the adjacent transverse processes, and are then continued into the abdominal wall. The arteries of the right side pass behind the inferior vena cava, and the upper 2 on each side run behind the corresponding crust of the diaphragm. The arteries of both sides pass beneath the tendinous arches, which give origin to the psoas major, and are then continued behind this muscle and the lumbar plexus. They now cross the quadratus lumborum, the upper 3 arteries running behind, the last usually in front of the muscle. At the lateral border of the quadratus lumborum, they pierce the posterior aponeurosis of the transversus abdominis, and are carried forward between this muscle and the obliquus internus. They anastomose with the lower intercostal, the subcostal, the iliolumbar, the deep iliac circumflex, and the inferior epigastric arteries. Branches. In the interval between the adjacent transverse processes, each lumbar artery gives off a posterior ramus, which is continued backward between the transverse processes and is distributed to the muscles and skin of the back. It finishes a spinal branch which enters the vertebral canal and is distributed in a manner similar to the spinal branches of the posterior rami of the intercostal arteries. Muscular branches are supported from each lumbar artery and from its posterior ramus to the neighbouring muscles. The middle sacral artery, A sacralis media, is a small vessel which arises from the back of the aorta, a little above its bifurcation. It descends in the middle line in front of the 4th and 5th lumbar vertebrae, the sacrum and coccyx, and ends in the glomus coccygeum, coccygeal gland. From it, minute branches are said to pass to the posterior surface of the rectum. On the last lumbar vertebrae, it anastomoses with the lumbar branch of the iliolumbar artery. In front of the sacrum, it anastomoses with the lateral sacral arteries and sends offshoots into the anterior sacral foramina. It is crossed by the left common iliac vein and is accompanied by a pair of venae committantes. These unite to form a single vessel which opens into the left common iliac vein. End of section 25. Recording by Marianne Coleman Hipkins. www.thisvoiceforyou.com
6 of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 3, by Henry Gray. The Common Iliac Arteries. A. Iliacae communes. The abdominal aorta divides, on the left side of the body of the fourth lumbar vertebra, into the two common iliac arteries. Each is about 5 centimeters in length. They diverge from the termination of the aorta, pass downward and lateralward, and divide, opposite the invertebral fibrocartilage between the last lumbar vertebra and the sacrum, into two branches, the external iliac and hypogastric arteries. The former supplies the lower extremity, the latter the viscera and parietes of the pelvis. The right common iliac artery is somewhat longer than the left, and passes more obliquely across the body of the last lumbar vertebra. In front of it are the peritoneum, the small intestines, branches of the sympathetic nerves, and, at its point of division, the ureter. Behind, it is separated from the bodies of the fourth and fifth lumbar vertebrae, and the intervening fibrocartilage, by the terminations of the two common iliac veins, and the commencement of the inferior vena cava. Laterally, it is in relation above with the inferior vena cava and the right common iliac vein, and below with the sosus major. Medial to it above is the left common iliac vein. The left common iliac artery is in relation, in front, with the peritoneum, the small intestines, branches of the sympathetic nerves, and the superior hemorrhoidal artery, and it is crossed at the point of bifurcation by the ureter. It rests on the bodies of the fourth and fifth lumbar vertebrae, and the intervening fibrocartilage. The left common iliac vein lies partly medial to and partly behind the artery. Laterally, the artery is in relation with the sosus major. Branches. The common iliac arteries give off small branches to the peritoneum, psoas major, ureters, and the surrounding areolar tissue, and occasionally give origin to the iliolumbar or accessory renal arteries. Peculiarities. The point of origin varies according to the bifurcation of the aorta. In 3/4 of a large number of cases, the aorta bifurcated either upon the fourth lumbar vertebra or upon the fibrocartilage between it and the fifth, the bifurcation being, in 1 case out of 9, below, and in 1 out of 11, above this point. In about 80% of the cases, the aorta bifurcated within 1.5 centimeters above or below the level of the crest of the ilium, more frequently below than above. The point of division is subject to great variety. In 2/3 of a large number of cases it was between the last lumbar vertebra and the upper border of the sacrum, being above that point in 1 case out of 8, and below it in 1 case out of 6. The left common iliac artery divides lower down more frequently than the right. The relative lengths also of the two common iliac arteries vary. The right common iliac was the longer in 63 cases, the left in 52, while they were equal in 53. The length of the arteries varied, in 5/7 of the cases examined, from 3.5 to 7.5 centimeters. In about half of the remaining cases the artery was longer, and in the other half shorter, the minimum length being less than 1.5 centimeters, the maximum 11 centimeters. In rare instances the right common iliac has been found wanting, the external iliac and hypogastric arising directly from the aorta. Collateral circulation. The principal agents in carrying on the collateral circulation after the application of a ligature to the common iliac are the asthenosis of the hemorrhoidal branches of the hypogastric with the superior hemorrhoidal from the inferior mesenteric, of the uterine, ovarian, and vesical arteries of the opposite sides, of the lateral sacral with the middle sacral artery, of the inferior epigastric with the internal mammary, inferior intercostal, and lumbar arteries, of the deep iliac circumflex with the lumbar arteries, of the iliolumbar with the last lumbar artery, of the obturator artery by means of its pubic branch with the vessel of the opposite side and with the inferior epigastric. End of section 26. Recording by David Lawrence in Brampton, Ontario, July the 4th, 2009.
23 of Grey's Anatomy Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Ellie. Anatomy of the Human Body, Part 3, by Henry Gray. 1. The hypogastric artery. Arteria hypogastrica, internal iliac artery. The hypogastric artery supplies the walls and the viscera of the pelvis, the buttock, the generative organs, and the medial side of the thigh. It is a short, thick vessel, smaller than the external iliac, about 4 centimeters in length. It arises at the bifurcation of the common iliac, opposite the lumbosacral articulation, and passing downward to the upper margin of the greater sciatic foramen, divides into 2 large trunks, an anterior and a posterior. Relations. It is in relation in front with the ureter, behind with the internal iliac vein, the lumbosacral trunk, and the piriformis muscle, laterally near its origin with the external iliac vein which lies between it and the psoas major muscle, lower down with the obturator nerve. In the fetus the hypogastric artery is twice as large as the external iliac, and is the direct continuation of the common iliac. It ascends along the side of the bladder and runs downward on the back of the anterior wall of the abdomen to the umbilicus, converging towards its fellow of the opposite side. Having passed through the umbilical opening, the 2 arteries, now termed umbilical, enter the umbilical cord, where they are coiled around the umbilical vein, and ultimately ramify in the placenta. At birth, when the placental circulation ceases, the pelvic portion only of the artery remains patent, and constitute the hypogastric and the first part of the superior vesical artery of the adult. The remainder of the vessel is converted into a solid fibrous cord, the lateral umbilical ligament, obliterated hypogastric artery, which extends from the pelvis to the umbilicus. Peculiarities as regards length. In 2/3 of a large number of cases, the length of the hypogastric varied between 2.25 and 3.4 centimeters. In the remaining third it was more frequently longer than shorter, the maximum length being about 7 centimeters, the minimum about 1 centimeter. The length of the common iliac, the hypogastric arteries, be in inverse proportion to each other, the hypogastric artery being long when the common iliac is short, and vice versa. As regards its place of division. The place of division of the hypogastric varies between the upper margin of the sacrum and the upper border of the greater sciatic foramen. The right and left hypogastric arteries in a series of cases often differed in length, but neither seemed constantly to exceed the other. Collateral circulation. The circulation of the ligature of the hypogastric artery is carried on by the anastomosis of the uterine and ovarian arteries, of the vesical arteries of the 2 sides, of the hemorrhoidal branches of the hypogastric with those from the inferior mesenteric, of the obturator artery by means of its pubic branch, with the vessel of the opposite side, and with the inferior epigastric and medial femoral circumflex, of the circumflex and perforating branches of the profunda femoris, with the inferior gluteal, of the superior gluteal with the posterior branches of the lateral sacral arteries, of the iliolumbar with the last lumbar, of the lateral sacral with the middle sacral, and of the iliac circumflex with the iliolumbar and superior gluteal. Branches. The branches of the hypogastric artery are from the anterior trunk, superior vesical, middle vesical, inferior vesical, middle hemorrhoidal, obturator, internal padental, inferior gluteal. In the female, uterine, vaginal. From the posterior trunk, iliolumbar, lateral sacral, superior gluteal. The superior vesical artery, arteria vesicalis superior, supplies numerous branches to the upper part of the bladder. From one of these slender vessels, the artery of the ductus deferens takes origin and accompanies the duct in its course to the testis, where it anastomoses with the internal spermatic artery. Other branches supply the ureter. The first part of the superior vesical artery represents the terminal section of the pervious portion of the fatal hypogastric artery. The middle vesical artery, arteria vesicalis medialis, usually a branch of the superior, is distributed to the fundus of the bladder and the vesiculae seminales. The inferior vesical artery, arteria vesicalis inferior, frequently arises in common with the middle hemorrhoidal and is distributed to the fundus of the bladder, the prostate, and the vesiculae seminales. The branches of the prostate communicate with the corresponding vessels of the opposite side. The middle hemorrhoidal artery, arteria hemorrhoidalis media, usually arises with the preceding vessel. It is distributed to the rectum, anastomosing with the inferior vesicle and with the superior and inferior hemorrhoidal arteries. It gives offsets to the vesiculae seminalis and prostate. The uterine artery, arteria uterina, springs from the anterior division of the hypogastric and runs medialward on the levata ani and toward the cervix uteri. About 2 centimeters from the cervix, it crosses above and in front of the ureter, to which it supplies a small branch. Reaching the side of the uterus, it ascends, in a tortuous manner, between the 2 layers of the broad ligament to the junction of the uterine tube and uterus. It then runs lateralward toward the hilus of the ovary, and ends by joining the ovarian artery. It supplies branches to the cervix uteri and others which descend to the vagina. The latter anastomose with branches of the vaginal arteries, and form with them 2 median longitudinal vessels. The acigus arteries of the vagina, one of which runs down in front of the vagina and the other behind. It supplies numerous branches of the body of the uterus, and from its terminal portion twigs are distributed to the uterine tube and the round ligament of the uterus. The vaginal artery, arteria vaginalis, usually corresponds to the inferior vesicle in the male. It descends upon the vagina, supplying its mucous membrane, and sends branches to the bulb of the vestibule, the fundus of the bladder, and the contiguous part of the rectum. It assists in forming the acigus arteries of the vagina, and is frequently represented by 2 or 3 branches. The obturator artery, arteria obturatoria, passes forward and downward on the lateral wall of the pelvis, and to the upper part of the obturator foramen, and, escaping from the pelvic cavity through the obturator channel, it divides into an anterior and a posterior branch. In the pelvic cavity, this vessel is in relation laterally with the obturator fascia, medially with the ureter, ductus deferens, and peritoneum, while a little below it is the obturator nerve. Branches. Inside the pelvis, the obturator artery gives off the iliac branches to the iliac fossa, which supply the bone and the iliacus, and anastomose with the iliolumbar artery, a vesical branch which runs backward to supply the bladder, and a public branch, which is given off from the vessel just before it leaves the pelvic cavity. The public branch ascends upon the back of the pubis, communicating with the corresponding vessel of the opposite side and with the inferior epigastric artery. Outside the pelvis, the obturator artery divides at the upper margin of the obturator foramen into an anterior and a posterior branch, which encircle the foramen under the cover of the obturator externus. The anterior branch, which runs forward on the outer surface of the obturator membrane and then curves downward along the anterior margin of the foramen, distributes branches to the obturator externus, pectineus, adductores, and gracilis, and anastomoses with the posterior branch and with the medial femoral circumflex artery. The posterior branch follows the posterior margin of the foramen and turns downward on the inferior ramus of the ischium, where it anastomoses with the anterior branch. It gives twigs to the muscles attached to the ischial tuberosity and anastomoses with the inferior gluteal. It also supplies an articular branch which enters the hip joint through the acetabular notch, ramifies in the fat of the bottom at the acetabulum, and sends a twig along the ligamentum teres to the head of the femur. Peculiarities. The obturator artery sometimes arises from the main stem or from the posterior trunk of the hypogastric, or it may spring from the superior gluteal artery. Occasionally it arises from the external iliac. In about 2 out of every 7 cases it springs from the inferior epigastric and descends almost vertically to the upper part of the obturator foramen. The artery in its course usually lies in contact with the external iliac vein, and on the lateral side of the femoral ring. In such cases it would not be endangered in the operation for strangulated femoral hernia. Occasionally, however, it curves along the free margin of the lanucular ligament, and if in such circumstances a femoral hernia occurred, the vessel would almost completely encircle the neck of the hernial sac, and would be in great danger of being wounded if an operation were performed by strangulation. The internal podental artery, arteria potenta interna, internal pubic artery, is the smaller of the 2 terminal branches of the interior trunk of the hypogastric, and supplies the external organs of generation. Though the course of the artery is the same in the 2 sexes, the vessel is smaller in the female than in the male, and the distortion of its branch is somewhat different. The description of its arrangement in the male will first be given, and subsequently the difference which it presents in the female will be mentioned. The internal podental artery in the male passes downward and outward of the lower border to the greater sciatic foramen, and emerges from the pelvis between the piriformis and the coccygus. It then crosses the ischial spine and enters the perineum through the lesser sciatic foramen. The artery now crosses the obturator internus along the lateral wall of the ischiorectal fossa, being situated about 4 centimeters above the lower margin of the ischial tuberosity. It gradually approaches the margin of the inferior ramus of the ischium and passes forward between the 2 layers of the fascia of the urogenital diaphragm. It then runs forward along the medial margin of the inferior ramus of the pubis, and about 2.25 centimeters behind the pubic accurate ligament it pierces the inferior fascia of the urogenital diaphragm and divides into the dorsal and deep arteries of the penis. Relations. Within the pelvis it lies in front of the piriformis muscle, the sacral plexus of nerves, and the inferior gluteal artery. As it crosses the ischial spine, it is covered by the gluteus maximus and overlapped by the sacrotuberous ligament. Here the podental nerve lies to the medial side, and the nerve of the obturator internus to the lateral side of the vessel. In the perineum it lies on the lateral wall of the ischiorectal fossa, in a canal, Alcock's canal, formed by the splitting of the obturator fascia. It is accompanied by a pair of venae comitantes and the podental nerve. Peculiarities. The internal podental artery is sometimes smaller than usual, or fails to give off 1 or 2 of its usual branches. In such cases the deficiency is supplied by branches derived from an additional vessel, the accessory podental, which generally arises from the internal podental artery before its exit from the greater sciatic foramen. It passes downward along the lower part of the bladder, and across the side of the prostate to the root of the penis, where it perforates the urogenital diaphragm, and gives off the branches usually derived from the internal podental artery. The deficiency most frequently met with is that in which the internal podental ends as the artery of the urethral pulp, the dorsal and deep arteries of the penis being derived from the accessory podental. The internal podental artery may also end as the perineal, the artery of the urethral bulb being derived with the other 2 branches from the accessory vessel. Occasionally the accessory podental artery is derived from one of the other branches of the hypogastric artery, most frequently the inferior vesicle or the obturator. Branches. The branches of the internal podental artery are muscular, inferior hemorrhoidal, perineal, artery of the urethral pulp, urethral, deep artery of the penis, dorsal artery of the penis. The muscular branches consist of 2 sets, one given off in the pelvis, the other as the vessel crosses the ischial spine. The former consists of several small offsets, which supply the levator ani, the obturator internus, the piriformis, the coccygus. The branches given off outside the pelvis are distributed to the adjacent parts of the gluteus maximus and external rotator muscles. The anastomose with branches of the inferior gluteal artery. The inferior hemorrhoidal artery, arteria hemorrhoidalis inferior, arises from the internal podental as it passes above the ischial tuberosity. Piercing the wall of Alcock's canal, it divides into 2 or 3 branches which cross the ischiorectal fossa and are distributed to the muscles and integument of the anal region, and send off shots around the lower edge of the gluteus maximus to the skin of the buttock. The anastomose with the corresponding vessels of the opposite side, with the superior and the middle hemorrhoidal, and with the perineal artery. The perineal artery, arteria perinei, superficial perineal artery, arises from the internal podental in front of the preceding branches and turns upward, crossing either over or under the transversus perinei superficialis, and runs downward parallel to the pubic arch in the interspace between the bulbocavernosus and the ischiocavernosus, both of which it supplies, and finally divides into several posterior scrotal branches, which are distributed to the skin and dartos tunic of the scrotum. As it crosses the transversus perinei superficialis, it gives off the transverse perineal artery, which runs transversely on the cutaneous surface of the muscle, and anastomoses with the corresponding vessel of the opposite side, and with the perineal and inferior hemorrhoidal arteries. It supplies the transversus perinei superficialis, the structures between the anus and the urethral bulb. The artery of the urethral bulb, arteria bulbi urethrae, is a short vessel of a large caliber which arises from the internal podental between the two layers of fascia of the urogenital diaphragm. It passes medialward, pierces the inferior fascia of the urogenital diaphragm, and gives off branches which ramify in the bulb of the ureter, and in the posterior part of the corpus cavernosum urethrae. It gives off a small branch to the bulbourethral gland. The urethral artery, arteria urethralis, arises a short distance in front of the artery of the urethral bulb. It runs forward and medialward, pierces the inferior fascia of the urogenital diaphragm, and enters the corpus cavernosum urethrae, in which it is continued forward to the glans penis. The deep artery of the penis, arteria profunda penis, artery of the corpus cavernosum, one of the terminal branches of the internal podental, arises from that vessel, while it is situated between the two fasciae of the urogenital diaphragm. It pierces the inferior fascia, and entering the crus penis obliquely, runs forward in the center of the corpus cavernosum penis, to which its branches are distributed. The dorsal artery of the penis, arteria dorsalis penis, ascends between the crus penis and the pubic symphysis, and piercing the inferior fascia of the urogenital diaphragm, passes between the two layers of the suspensory ligament of the penis, and runs forward on the dorsum of the penis to the glans, where it divides into two branches, which supply the glans and the prepuce. On the penis it lies between the dorsal nerve and the deep dorsal vein, the former being on its lateral side. It supplies the integument and fibrous sheath of the corpus cavernosum penis, sending branches through the sheath to anastomose with the preceding vessel. The internal podental artery in the female is smaller than in the male. Its origin and course is similar, and there is considerable analogy in the distribution of its branches. The perineal artery supplies the labia putendi, the artery of the bulb supplies the bulbus vestibuli and the erectile tissue of the vagina, and the deep artery of the clitoris supplies the corpus cavernosum clitoris, and the dorsal artery of the clitoris supplies the dorsum of the organ, and ends in the glans and prepubis of the clitoris. The inferior internal gluteal artery, arteria glutea inferior, sciatic artery, the larger of the two terminal branches of the anterior trunk of the hypogastric, is distributed chiefly to the buttock and back of the thigh. It passes down on the sacral plexus of nerves and the piriformis, behind the internal podental artery, the lower part of the greater sciatic foramen, through which it escapes from the pelvis, between the piriformis and the coccygus. It then descends in the interval between the greater trochanter of the femur and tuberosity of the ischium, accompanied by the sciatic and posterior femoral cuteus nerves, and covered by the gluteus maximus, and is continued down the back of the thigh, supplying the skin and anastomosing with the branches of the perforating arteries. Inside the pelvis it distributes branches to the piriformis, coccygus, and levator ani, some branches which supply the fat around the rectum and occasionally take the place of the middle hemorrhoidal artery, and vesical branches to the fundus of the bladder, vesiculae seminalis, and prostate. Outside the pelvis it gives off the following branches: muscular, coccygeal, committens nervi ischiadici, anastomotic, articular, cutaneous. The muscular branches supply the gluteus maximus, anastomosing with the superior gluteal artery in the substance of the muscle, the external rotators anastomosing with the internal podental artery, and the muscles attached to the tuberosity of the ischium anastomosing with the posterior branch of the obturator and the medial femoral circumflex arteries. The coccygeal branches run medialward, pierce the sacrotuberous ligament, and supply the gluteus maximus, the integument, and other structures on the back of the coccyx. The arteriocommitans nervi ischiadici is a long, slender vessel, which accompanies the sciatic nerve for a short distance. It then penetrates it and runs in its substance to the lower part of the thigh. The anastomotic is directed downward across the external rotators and assists in forming the so-called crucial anastomosis by joining with the first perforating and medial and lateral femoral circumflex arteries. The articular branch, generally derived from the anastomotic, is distributed to the capsule of the hip joint. The cutaneous branches are distributed to the skin of the buttock and back of the thigh. The iliolumbar artery, arterio iliolumbalis, a branch of the posterior trunk of the hypogastric, turns upward behind the obturator nerve and the external iliac vessel to the medial border of the psoas major, behind which it divides into a lumbar and an iliac branch. The lumbar branch, ramus lumbalis, supplies the psoas major and the quadratus lumborum, anastomosis with the last lumbar artery, and sends a small spinal branch through the intervertebral foramen, between the last lumbar vertebra and the sacrum, into the vertebral canal to supply the cauda equina. The iliac branch, ramus iliacus, descends to supply the iliacus. Some offsets running between the muscle and the bone anastomose with the iliac branches of the obturator. One of these enters an oblique canal to supply the bone, which others run along the crest of the ilium, distributing branches to the gluteal and abdominal muscles, and anastomosing in their course is the superior gluteal, iliac circumflex, and lateral femoral circumflex arteries. The lateral sacral arteries, arteria sacralis lateralis, arise from the posterior division of the hypogastric. There are usually two, a superior and an inferior. The superior, of large size, passes medialward, and after anastomosing with branches from the middle sacral, enters the first or second anterior sacral foramen, supplies branches to the contents of the sacral canal, and, escaping the corresponding posterior sacral foramen, is distributed to skin and muscle of the dorsum of the sacrum, anastomosing with the superior gluteal. The inferior runs obliquely across the front of the piriformis and the sacral nerves of the medial side of the anterior sacral foramina, descends on the front of the sacrum and anastomoses over the coccyx, with the middle sacral and opposite lateral sacral artery. In its course it gives off branches, which enter the anterior sacral foramina. These, after supplying the contents of the sacral canal, escapes by the posterior sacral foramina, and are distributed to the muscles and skin of the dorsal surface of the sacrum, anastomosing with the gluteal arteries. The superior gluteal artery, arteria glutea superior, gluteal artery, is the largest branch of the hypogastric, and appears to be the continuation of the posterior division of that vessel. It is a short artery which runs backward between the lumbosacral trunk and the first sacral nerve, and, passing out of the pelvis above the upper border of the piriformis, immediately divides into a superficial and a deep branch. Within the pelvis it gives off a few branches to the iliacus, piriformis, and obturator internus, and just previous to quitting that cavity a nutrient artery which enters the ilium. The superficial branch enters the deep surface of the gluteus maximus and divides into numerous branches, some of which supply the muscle and anastomose with the inferior gluteal, while others perforate the tendinous origin and supply the integument covering the posterior surface of the sacrum, anastomosing with the posterior branches of the lateral sacral arteries. Deep branch lies under the gluteus medius, and almost immediately subdivides into two. Of these, the superior division, continuing the original course of the vessel, passes along the upper border of the gluteus minimus to the anterior superior spine of the ilium, anastomosing with the deep iliac circumflex artery and the ascending branch of the lateral femoral circumflex artery. The inferior division crosses the gluteus minimus obliquely to the greater trochanter, distributing branches to the glutei, and anastomosis with the lateral femoral circumflex artery. Some branches pierce the gluteus minimus and supply the hip joint. End of section 23. Recording by Ellie, June 2009.
#28 of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 3, by Henry Gray. The external iliac artery. A. iliaca externa. The external iliac artery is larger than the hypogastric, and passes obliquely downward and lateralward along the medial border of the psoas major, from the bifurcation of the common iliac to a point beneath the inguinal ligament, midway between the anterior superior spine of the ilium and the symphysis pubis, where it enters the thigh and becomes the femoral artery. Relations. In front and medially, the artery is in relation with the peritoneum, subperitoneal areola tissue, the termination of the ilium, and frequently the veriform process on the right side and the sigmoid colon on the left, and a thin layer of fascia derived from the iliac fascia which surrounds the artery and vein. At its origin it is crossed by the ovarian vessels in the female and occasionally by the ureter. The internal spermatic vessels lie for some distance upon it, near its termination, and it is crossed in this situation by the external spermatic branch of the genitofemoral nerve and the deep iliac circumflex vein. The ductus deferens in the male and the round ligament of the uterus in the female curve down across its medial side. Behind, it is in relation with the medial border of the psoas major, from which it is separated by the iliac fascia. At the upper part of its course, the external iliac vein lies partly behind it, but lower down lies entirely to its medial side. Laterally it rests against the psoas major, from which it is separated by the iliac fascia. Numerous lymphatic vessels and lymph glands lie on the front and on the medial side of the vessel. Collateral circulation. The principal anastomosis in carrying on the collateral circulation after the application of a ligature to the external iliac are the iliolumbar with the iliac circumflex, the superior gluteal with the lateral femoral circumflex, the obturator with the medial femoral circumflex, the inferior gluteal with the first perforating and circumflex branches of the profunda artery, and the internal pudental with the external pudental. When the obturator arises from the inferior epigastric, it is supplied with blood by branches from either the hypogastric, the lateral sacral, or the internal pudental. The inferior epigastric receives its supply from the internal mammary and the lower intercostal arteries, and from the hypogastric by the anatomosis of its branches with the obturator. Branches. Besides several small branches to the psoas major and the neighboring lymph glands, the external iliac gives off two branches of considerable size: inferior epigastric, deep iliac circumflex. The inferior epigastric artery, A. epigastrica inferior, deep epigastric artery, arises from the external iliac, immediately above the inguinal ligament. It curves forward in the subperitoneal tissue and then ascends obliquely along the medial margin of the abdominal inguinal ring. Continuing its course upward, it pierces the transversalis fascia and, passing in front of the linea semicircularis, ascends between the rectus abdominis and the posterior lamella of its sheath. It finally divides into numerous branches which anastomose above the umbilicus, with the superior epigastric branch of the internal mammary, and with the lower intercostal arteries. As the inferior epigastric artery passes obliquely upward from its origin, it lies along the lower and medial margins of the abdominal inguinal ring, and behind the commencement of the spermatic cord. The ductus deferens, as it leaves the spermatic cord in the male, and the round ligament of the uterus in the female, winds around the lateral and posterior aspects of the artery. Branches. The branches of the vessel are the external spermatic artery, cremasteric artery, which accompanies the spermatic cord and supplies the cremaster and other coverings of the cord, anastomizing with the external spermatic artery. In the female it is very small and accompanies the round ligament. A pubic branch which runs along the inguinal ligament and then descends along the medial margin of the femoral ring to the back of the pubis, and there anastomoses with the pubic branch of the obturator artery. Muscular branches, some of which are distributed to the abdominal muscles and the peritoneum, astomosing with the iliac circumflex and lumbar arteries. Branches which perforate the tendon of the obliquus externus and supply the integument, astomosing with branches of the superficial epigastric. Peculiarities. The origin of the inferior epigastric may take place from any part of the external iliac between the inguinal ligament and a point 6 centimeters above it, or it may arise below this ligament from the femoral. It frequently springs from the external iliac by a common trunk with the obturator. Sometimes it arises from the obturator, the latter vessel being furnished by the hypogastric, or it may be formed of two branches, one derived from the external iliac, the other from the hypogastric. The deep iliac circumflex artery, A. circumflexa ilium profunda, arises from the lateral aspect of the external iliac, nearly opposite the inferior epigastric artery. It ascends obliquely lateralward behind the inguinal ligament, contained in a fibrous sheath formed by the junction of the transversalis fascia and iliac fascia, to the anterior superior iliac spine, where it antemoses with the ascending branch of the lateral femoral circumflex artery. It then pierces the transversalis fascia and passes along the inner lip of the crest of the ilium to about its middle, where it perforates the transversus and runs backward between that muscle and the obliquus internus to anastomose with the iliolumbar and superior gluteal arteries. Opposite the anterior superior spine of the ilium, it gives off a large branch, which ascends between the obliquus internus and transversus muscles, supplying them anastomosing with the lumbar and inferior epigastric arteries. Note: Sir Astley Cooper describes in Guy's Hospital Reports, Volume 1, the dissection of a limb 18 years after successful ligature of the external iliac artery. End note. End of section 28. Recording by David Lawrence. July 1st, 2009, in Brampton, Ontario.